This is 5P Podcast, the first international regenerative medicine and anti-aging podcast that will give you the tools to age with the greatest health, wellness, and appearance. It is directed by Professor Dr. Jaime Rodriguez Quintosa and Professor Dr. Debbie Vinsky. We welcome you to the 6th episode. We are your hosts, Sandra Sola and Professor Carlos Galante.
We are at the headquarters of J. Reese Productions with Smith Studios, the podcast accelerator that walks you through the steps to create a successful podcast from scratch. We invite you to subscribe to our YouTube channel at 5P Podcast to learn more about this topic. As you will know, we have with us the 5P Podcast Ambassador, Professor Dr. Debbie Vinsky, the Queen of Anti-Aging Medicine and President of the World Council for Preventive, Regenerative, and Anti-Aging Medicine, WOCPM. Welcome, Professor.
Thank you, Sandra, and thank you, Professor Carlos. And I'd like to welcome our famous Dr. Ibrahim El Achkar. He is an experienced cutting-edge plastic surgeon, ENT specialist, and maxillofacial surgeon with degrees from St. Joseph University, Beirut, and the College of Medicine in Paris, France. And Dr. Ibrahim El Achkar is a doctor from all celebrity around the world, I think. He's also lecturer at esteemed institutions such as the American Academy of Otolaryngology, Head and Neck Surgery, and the International Congress in Aesthetic and Anti-Aging Medicine. Welcome, Dr. Ibrahim, and we'd like to start the podcast with the same question to all our guests because it's very important. Why did you decide to dedicate yourself to not only plastic surgery, but also to anti-aging medicine? Why?
Thank you for this beautiful introduction, dear Debbie.
Thank you.
So, it is very important for people to get an anti-aging treatment because nowadays a person at 50 he is in full activity. At 60 he is in full activity. At 70 he is in full activity. So we need to be young. We need to look younger and fresh. We need to have energy. We need to be active. That's why it's very important to investigate in anti-aging. That's why I am with you, Professor Debbie, in this WOCPM to improve the anti-aging and to help each other to create the best for the medicine.
Doctor, you are one of the leading doctors in the world of treating patients with fat grafting. Could you explain to us what this method is about?
Fat grafting. It is one of the most important anti-aging procedure because we take the fat which contains stem cells and we put it in another place where this place or area needs more volume and need to be in better condition. For example, a lot of patients, they have problems, especially with aging around the eyes. So when we take the fat, which contains stem cells, and we graft it around the eyes, all this area will be in better condition. The skin we improve the skin, we improve the dark circle, we improve the muscle around eyes. And the same for each of the body. So each part of the body badly, we can put fat and stem cells, so it will improve this part. First, because we put fat, so the fat by itself improves the area, and the stem cell, it means regeneration. So this area where you put the fat and the stem cell will be in a good conditions to do a regenerative tissue and to be in good condition as anti-aging procedure.
So it's like using Botox. I mean, what's the difference between Botox and this method you're explaining? And is fat grafting better then?
Botox is different than filler or fat. Botox by itself is a medicine and it can be used as anti-aging. Botox, we can treat the muscles by the Botox. And with age, our face, the muscles in the face will be under tension. It means the muscle will contract more and more. So we need to relax this muscle. When a muscle in the face contracts too much, you have wrinkles, you have a closed face. So we do Botox to relax this muscle, so you have an open face, so you have an anti-aging procedure with Botox that is different than the procedure of fat graft. We can compare the fat graft with filler, but it is better than filler. Why? Because first, the fat is from your body, so no reaction. Second, the fat contains stem cells. So everywhere you put this filler, the fat graft, it not only improves the volume of the area, but also the quality of all the structure of the area because of the stem cells and because of the fat. So also it's an anti-aging procedure because with age, as we know, you have the fat is reduced. So we put fat. Second, the bone also, we have resorption of the bone. So we put the fat deep on the bone to do like reconstruction of our bone in the face. So this procedure, the fat graft, is a full option if you want. It's a filler, a regenerative procedure, and improve the area, the bone, the muscle, the skin. So why don't use the fat, which contains stem cells?
Thank you, doctor.
Yeah.
Yeah. Please.
Botox and fat graft are complementary. It means we can do them together to improve the anti-aging procedure.
Okay.
And is the fat grafting the same as nanofat?
A very important question. For me, fat graft is more important than nanofat. Why? Because fat graft, you have viable cells. Nanofat. What is nanofat? So we take the fat and we put them in different syringe or machines. So you get fragments of cells. It is important because you have the fragment of the adipocyte, the fragment of stem cell, you have all the enzymes, you have all the material that can improve this area, but not a viable cell. For me, I use nanofat in areas they don't need fillers or they don't need to improve the volume of the area. I use nanofat. But when we need volume to enhance the volume of the area, the best is to put fat or fat-enriched stem cell. It means we take part of the cell, we take the stem cells, and we add them to the fat. So we have fat-enriched stem cells.
Okay. Well, it's so interesting. This you're saying, it's amazing. The results you shared in your lecture named Fat Grafting, Nanofat, and Fat Enriched Stem Cell during the first International Health Conference in Bali were breathtaking. However, I have a question that comes to my mind. How much do you have to wait to see the results of this procedure?
Normally, you see immediately the result of the filler effect. But then after, you will see the result getting better and better with time. And what is important, that this result will stay for life because you do a graft. So these cells, the adipocyte and stem cell, when we do the graft, they live for life. And what is interesting, in my patients, when I see them after 5, 10 years, 15 years, they have the same glowy face and the same result. But it's important because when you do fat graft, if the person gets weight, the fat will be bigger. So it's important to tell the patient when they do fat graft not to get weight. They can have a very big problem if they get too much weight. And when they lose weight, also the fat we graft increase in volume. But trust me, you can see the good result even after 10, after 15 years.
And do you use the person who wants to do these techniques as a donor always, or do you need fat from other people to another person?
No, very important to use the same fat of the person. We cannot use the fat of other person because we can have a severe allergic reaction, and it can be mortal. So it's important to use our own fat.
And
we always can find fat because I did fat for person who are very active in sport, marathon. We always can find fat because some area in the body we had stubborn fat that will not go. We can take it. don't worry.
And which are the side effects of these techniques?
For fat graft, in my hand, I don't have any side effects. 5 years ago, they asked me in Frankfurt in a congress to speak about the complication of the fat graft. And I told them I do a lot of rhinoplasty. Sometimes I have problem. I do Botox. Sometimes I have problem. I do fillers. Sometimes I have problem. But fat graft, I'm doing fat graft since 2000, means 25 years. I never had a problem with fat graft. I guess because the fat is from your body, you are not using material from outside your body, and you inject them correctly to your face, to the body. So I never had any problem or any side effect. But I saw 2 patients treated elsewhere, and they had a problem of infection in the body. In my hands, I never had problem, and I put the fat everywhere since 2000, 2002, 2003. I put them around eyes, everywhere in the face, in the body. Never I had a problem with fat.
Okay, thank you. We remind you that we are interviewing Dr. Ibrahim El Achkar. He is an experienced cutting-edge plastic surgeon, ENT specialist, and maxillofacial surgeon with degrees from Saint Joseph University, Beirut, and the College of Medicine in Paris, France. If you're enjoying this episode, don't forget to subscribe to our YouTube channel at 5P Podcast and follow Dr. Ibrahim's work on his social media at dr.ibrahimashkar. So, those grafting techniques are impressive. However, I don't want to miss the opportunity to talk about another term that you invented and published in Journal of Otolaryngology, Head and Neck Diseases. The new term, I think, is dancing chin, right? Can you explain to the audience what that is?
Dancing chin is an involuntary contraction of the muscle of the chin that pass ignored because it's only appears when people speak. So it pass ignored because people, they don't look to the mirror and speak. So they found the deformity only when they see the pathology. The pathology of the chin is golf ball deformity, reduce the length of the chin, pull your face down, and you have the skin like peau d'orange. You have hyperinflammation of the skin. So first you have golf ball deformity. So dancing chin, I'm describing the phenomenon that lead to the pathology. So it's very important because if you treat it early, you never have a problem of golf ball deformity or skin problem, or you never have your face down. So it's the treatment of the dancing chin is an anti-aging procedure. You know, the muscles of the chin are the mentalis. When the mentalis contract, it pull your chin and reduce your chin and reduce the skin. You have the depressor labii and depressor anguli. So depressor. So these muscles, they pull your face down. That's why you have the marionette lines or plis de l'amertume, sadness, wrinkles. So like this, all these muscles, when they contract, they pull your face down. They reduce your chin. So to treat it early is very important. That's why I insist to create a name of this phenomenon, and that this name to be popular. So it was important that this name be funny, easy, and to describe this phenomenon. That's why I thought that dancing chin will be very interesting. It will go easy, that doctors and people, they understand it, and they will come and treat it early. Because if you relax these muscles of the chin, you will never have your face to pull down. You will never have the turkey neck, because here is the center of the muscles. When these muscles contract, they pull your face down, the platysma will contract. If you relax this area, you relax your neck, you relax your face. So it's a treatment of dancing chin is a very important procedure, anti-aging procedure. That's why I am with you.
Okay.
Thank you.
So we did a song for the dancing chin like dancing queen. We'll send it to you after.
Yes, we need to put that song on the podcast. So that's okay.
Yes, I think so. And you should patent that dancing chin, because after Dr. Ibrahim do presentation and speak around the world, patients start to come to their doctor and ask, "Oh, can you treat my dancing chin like that?" And actually, in the textbook, that name is not exist, only by Dr. Ibrahim.
That's why you're pioneer. That's very pioneer.
You know, in medicine, we have a lot of names. For example, lion's wrinkle, crow's feet, smoking
Yes.
lines. All these are okay, but dancing chin is more important. You know why? Because
Yeah.
all the others, the patient can see them on the mirror, but the dancing chin, the others can see it. So they tell them, it's like when you go to psychologist, you tell him, how am I? Dancing chin is the same. So normally, because it was ignored, so it is more important than others because it is ignored by the patient. He cannot see it on the mirror.
And how can be aware that we have dancing chin? Because if I don't see it, how I know I need some help in that to treat it in a preventive way, I mean.
Yes, exactly. Very important question. Normally, now, a lot of people, they come to me, they told me I have dancing chin. And I told them, how you know you have the dancing chin? Some of them, they look at the mirror and they speak. When we speak at the mirror, we have contraction, but normally we control our contraction. So they can see it a little bit. Others, now they look at the video, and when they do video call, so they see their chin and other the partners and sister. Now people they are looking at the contraction of the muscles because on social media and because everywhere I'm talking about the dancing chin. So now when a person sees the other, when he speaks, he has the dancing chin, telling me, oh, you have dancing chin. So now more and more people realize that there is something known dancing chin. First, I have this idea because it was difficult to convince a person that he have a problem, that he don't see it at the mirror. Very difficult. That's why I was thinking, I spend hours to explain that they have contraction when they speak. And it's difficult to convince them that they have this pathology. Now with this nomination, it is easier. Most of them, maybe 70% now, they come with a diagnosis. Others, I always take a video of my patient to show them how it contracts.
And is there any health issue related to this condition, this dancing chin?
It means, sorry, can you repeat the question, please?
Yes, of course. Is there any health condition like it's you say that it's a pathology? For example,
Yes.
if it's contracts so much, is there any health issue related to this dancing chin?
Yes, sure. When it contracts too much with time, the skin, you have the pathology of the skin. First, the skin will appear like a golf ball deformity. You have hypervascularization because you have inflammation. When you have this muscle, this contraction of the muscles, it's like when you have contraction in the neck, when you have contraction over contraction, so it will affect the skin. And after you have all the skin of the chin with its contraction, and you cannot relax these muscles. These are the pathology. The pathology is the hypercontraction, so you have to relax it. And others, aesthetic, or for me, it's not only aesthetic. When you have muscles who pull your face down, it's a pathology. When you have muscles, they reduce the projection of the chin, is a pathology. When you have the skin is not normal and inflammation, it's a pathology. So for me, this treatment is very important because not treated, you have a lot of inconvenient, healthy and aesthetic.
And this dancing chin is indeed a new concept in medicine that you invented. When did you decide to start treating these patients?
I decide to treat them before I have the idea of the dancing chin, because I observe my patients when they came for consultation. So I observe them and I begin to see the contraction. And when I observe the contraction of the chin and I see the marionette lines or plis de l'amertume, sadness, wrinkles, then after I see for an elder patient the same imprint and the same deformation as I see for only, because when you see the young with golf ball deformity and in elder you see this deformity always persistent. In young you see it only when they speak. In elder You see it always. It means this phenomenon and this contraction will lead at old age to this deformity. When a young person, when he speak, he have this reaction to pull your face down, and you have the smoking line also is on the dancing chin, and you have the marionette lines, and you see them in elder patient with a deep wrinkles. That means for me, if they stay doing this contraction, it will lead to this deformity, to these wrinkles, like the lion wrinkles. Because they contract, repetitive contraction, you have the skin is cutting, and you don't have any more the continuity of the skin. You have a deep wrinkle. So it's a trauma for the skin.
Okay, so how can you treat it? I mean, is it a chronic condition or it can be reversed?
It can be reversed. The treatment. First, the easy one, I told them to speak to the mirror and to try to contract their muscles. If not, the treatment is the Botox. The Botox is a medicine, was created maybe 60 or 70 years ago to treat the young children who has a contraction of the hands or feet to relax the hands or to relax their muscles. So it's a medicine. The Botox is a medicine. We can do it for migraine, for contraction of the neck, of the back. So the treatment of the dancing chin is the Botox. I do the Botox, and I tell my patient to come to do it every 3 months. Why every 3 months? I want to relax these muscles. A muscle relaxed for more than a year, it will be thin and weak, and it will never contract again. Like when someone broke his hand, he rests for 6 weeks, and then after the muscles will be, you have to treat your muscles to improve the movement. So what we need here is to relax this muscle for long periods. So it is a treatment. I do Botox for my face, okay? Now, because I do my Botox every 4 or 5 months, now when I do the Botox for my face, I don't feel the change. Why? Because my face is treated already. All the muscles who contract my face are relaxed. So my face is treated. I don't have any more muscles who have over-contracted. Same for people who say bruxism people, they grant their teeth. So we do Botox for the masseter, also to relax. It's a treatment.
Okay, so when is the best time to treat this condition?
Early. I have an assistant. She came to work. She had 21. She had a severe dancing chin with inflammation. You see the circle of the chin red. You see, because she is blondie, you see the new neovascularization of the skin because of the inflammation. So I begin to treat her at 20. So there is no age. When you see the contractions, you treat immediately.
And can we men have this condition also? Do you have more women treating dancing chain, or do you have men also as patients?
Yes, most of them are women, but we have maybe 5% men. George Clooney had a serious dancing chin. So yes, men also have dancing chin, but women more, because women, they contract their face too much, they express more. That's why.
Thank you, Dr. Ibrahim. Dr. Ibrahim, I have another question. What would you say to those who are listening to this podcast that may be worried or want to have the solution of their dancing chin, or are considering in doing fat grafting?
For me, first, for the fat graft, this procedure is really physiologic procedure, because the fat is from your body, contains stem cells. It's an anti-aging procedure. If we can do it, you always have good results on different levels, multiple good results. So it enhances the area and rejuvenate the area where you put it, especially around eyes. For the dancing chin, I recommend everyone who notice that he has the dancing chin to begin the treatment as early as he can to prevent an early aging and an early aging. You know, people, they don't like the marionette lines. A lot they don't like the marionette lines. In French, we said a pli de l'amertume. Amertume. It means the wrinkles of sadness, more than sadness, amertume in English. So it's really ugly, and people, they hate it. Second, for the skin, all deformity, and it's tuck, like this. All deformity, you see? I don't know. Yes.
Yeah.
There.
So you see that we don't like in our skin any holes. So we like smooth skin. We don't like wrinkles. That's why very important to treat it early.
Thank you.
I would
Thank you very much.
like,
Thank
dear Debbie and Sandra and Dr. Carlos,
you.
really, it's a big effort you did, really. And what is important is this conference is only to spread knowledge of anti-aging,
Yes.
how we can old younger, and how we can age younger. This is very important to everyone. Everyone, what we need, it's not to have no wrinkles, it's to age younger. Thank you for your effort. You are helping the humanity, really. Aging younger and healthy aging is very important.
Thank you.
Thank you, Dr.
Thank you, Dr.
Yes, thank you, Dr. Ibrahim. And I think we all are very lucky in a 5P podcast from Jeris, Barcelona, and I'm from Jeris, the Finsky Tower, Jakarta, because we have time with Dr. Ibrahim, the prominent plastic surgeon and anti-aging specialist in the world. We interview Dr. Ibrahim El Achkar. He's an experienced cutting-edge plastic surgeon, ENT specialist, and maxillofacial surgeon with degrees from St. Joseph University, Beirut, and the College of Medicine in Paris, France, and also board member of the World Council of Preventive, Regenerative, and Anti-Aging Medicine, was CPM, in Paris. And I remember I heard Dr. Ibrahim's speaking about fat grafting, I think around more than 10 years ago. So he is one of the first doctor who do this, and then also invented the dancing chin. You should patented that. And Dr. Ibrahim also lecturer at esteemed institutions such as the American Academy of Otolaryngology, Head and Neck Surgery, and the International Congress in Aesthetic and Anti-Aging Medicine. The last one is in Bali. And I hope to see you again in the 10th of November 2024 in Bali. Again, will be opened by our President of Republic of Indonesia. All right, Sandra.
Thank you for listening and supporting this initiative. We invite you to subscribe to our YouTube channel at 5P Podcast. If you want to learn how to make a successful podcast, subscribe to at Wavesmith Studios on YouTube. See you next time, and remember, take care of yourself today to defy time tomorrow.